let's talk about the management of the fibroid. How we treat the fibroid, how we manage it. So there are two types of management. Either we only observe the fibroid or we do some intervention. Those patients, those fibroid size is less, symptoms are less, fibroid is less than 5 centimeter and it's just a chance finding on the ultrasound, then we can very well observe those fibroids. We can do serial monitoring, ultrasound once in 6 months, and we can see that fibroid is not increasing in size and patient is not having much symptoms. In that case, patient may be put on observation. And the second scenario in which the patient is symptomatic, patient is having bleeding, patient is having pain, pressure symptoms, then in that case we need to, or there is increase in the size of the fibroid, then we need to intervene. We need to do something about the fibroid. So there are certain invasive and non-invasive methods of treating the fibroids. About non-invasive method or medical management regarding the fibroids, then we have certain options in the form of hormones, oral contraceptive pills, or we have tranexamic acid, Taxid, which may decrease the fibroids bleeding during the periods. But these medical managements are not very effective for fibroids. You can take it for some time, and if your symptoms are less and your bleeding may stop for some time, but they are not the definitive treatments. Another line of treatment is GnRH hormones or GnRH analogs. These are specific types of injections which cause a sort of pseudomenopause. They decrease the hormone levels in your body and the size of the fibroid may shrink a bit. Maybe one injection can decrease the size by 1 or 2 centimeter, and mainly these injections are just give us a window for improvement of the patient, especially in those patients those who are anemic, hemoglobin is very less. For definitive treatment we have to prepare the patients, then we can give the injection, bleeding may be stopped for some time, we can optimize the patient and then we can treat the patients. But GnRH also analogs are not also the definitive cure for the patient, but yes, it can be given. It is one of the options in certain selected patients. Uterine artery embolization is a process, it's a procedure, it is an invasive method which is done by the intervention radiologist, in which they put some gel foams, they block the blood supply to the uterus. They put certain type, they cannulate the femoral vessels usually, and they cannulate the uterine artery. They block the uterine artery with the gel foams. It's a minimally invasive procedure which is done by interventional radiologist, and it is effective mainly for those patients who present with heavy bleeding and those patients who don't want to go for surgical management. Uterine artery embolization is one of the effective methods. But those patients who want to conceive in future, uterine artery embolization may not be a perfect method. For the patients in which the size of the fibroid is big and they want to plan pregnancy, then surgery is the best method for them. If we talk about the surgery, then there are two types of the surgery, either removal of the fibroid or removal of the uterus itself. The definitive management for the fibroids will depend upon the symptoms of the patient, age of the patient, and what patients want. Whether patient wants pregnancy or no, whether patient is reproductive age or perimenopausal age. All these symptoms we put in front of us and we individualize the treatment for every patient. There are basically two types of the surgeries. One is the open surgery or conventional surgeries, in which we open the patient and we remove the fibroids or we remove the uterus. Then the other type is the laparoscopic surgery. It's minimally invasive endoscopic surgery or robotic surgeries. Laparoscopy and robotic both are the preferred method in selected patients, and the basically advantage of this technique is patient recovers very fast. patient goes to work and patient discharges from the hospital within 24 to 48 hours. The pain post-operative is very less and the patient is very healthy and goes back home fast. And blood loss during surgery is minimal. Robotic is the most advanced technique which is available nowadays for the treatment of the fibroids, and it is very effective for the patients. But at the end, I would say we have to individualize the patient. We have all the options of surgery and medicines and injections available depending upon the symptoms of the patient, findings of the patient, location and size of the fibroid. We have to individualize the treatment for every patient.